Hi, everyone. It's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head Neck Surgery. And today I'm blessed to have with me again one of my stellar former medical students, Morgyn Davis, who is now completing her second year of residency at UC San Diego. Hi, Morgyn.
Hi, everyone.
Today we're going to discuss how to be a successful intern. So, Morgyn, can you give us one thing that you wish you had known going into intern year?
It's helpful just to know, even though you're going to get stressed out, even though you're going to be tired, even though you're going to have moments of frustration, remember to always be nice to all of the support hospital staff. So
That is sage advice. Woo. So, inquiring minds want to know how to organize the day so that you're efficient with inpatient floor work so that you can get to the operating room and also actually do some reading.
Well, I feel like that's really a learning experience for everyone. So obviously you'll have to tailor it and do what works best for you. What worked for me was I would try to get to the hospital, 30, 40 minutes before I needed to get there so that I would have time to read and start to prep patient notes. So as you're looking through the patient chart and updating the list, go ahead and start writing notes where you can update the subjective or interval events that happened and kind of go ahead and pre-formulate in your mind what you think the plan would be for that day.
Perfect. So as an otolaryngology intern, obviously that year is mixed with ENT rotations, but also non-service related rotations. So how did you maximize your learning experiences on the other non-ENT blocks?
I think that you have to just take each rotation and look at a standalone learning opportunity, because every single rotation that's integrated in your intern year, there's something that you can benefit from it. For instance, we did a month of anesthesia, and as ENTs, you are one of the most knowledgeable people in the hospital about someone's airway. So you better use that anesthesia rotation to get 100% confident in intubating a patient to where it's almost like second nature. And then especially in the emergency room, I found that rotation was really, really beneficial because a lot of your ENT consults will come to the emergency room first. And so if you're the intern that's in the emergency room, you're the first person that's getting to see the patient. So that's an excellent opportunity to learn how to do straightforward procedures like INDs of odontogenic abscesses or draining a PTA or evaluating a patient that comes in with a nasal bone fracture. So what I would always do is I would, after talking to the residents, say, hey, by the way, will you just text me or call me when you get here? I'm interested in seeing and helping you do the procedure.
One final question. What was the most exciting thing about being an intern?
One thing that was very exciting was just getting to know, residents between all the different specialties and formulating friendships and connections.
That's awesome. All of your advice is so pertinent and right on target. Thank you for sharing. And for all of you, if you find my tips helpful, share them with your friends and continue to follow me at Dr. Gina Joe on Instagram, YouTube, and Twitter.